when I was a kid. Well, you're absolutely right, because they've been around for over 120 years. Jeff, thank you for joining us this morning.
Absolutely, Keith. Pleasure to be here.
We're interviewing Jeff today, and again, the theme is around the COVID-19 this month, and we want to introduce and interview a small business is one of the perspectives to take a look at how this is affecting our community. So Jeff, thanks again. Jeff, tell us a little bit about how the coronavirus has impacted city cleaners, and a question I'm waiting to find out is whether you've seen more business or less business, given that you're in the cleaning business. So.
Well, you would think maybe some more, but it's actually been pretty devastating to the industry as a whole.
Okay.
As I can guess, many of you that even might have a dress shirt on now are probably maybe still wearing pajama pants down.
You caught me.
I won't make anyone stand up to show us, but yeah, with everyone working from home, we've definitely seen industry-wise, we're looking at 60 to 70% off. Oh. And we have been an essential business, so we've stayed open throughout all of this. But overall, yeah, it's been really difficult.
And so, have you had to lay off workers as well, or furlough them for the time being?
Yeah, for a period of time, we did lay off a good portion of our staff. We have started to open up our hours a little bit more as things start to move through. We were able to secure some of the PPP funding, so that has enabled us to do some business things that we wouldn't have done maybe necessarily otherwise, to keep our people working, to keep us out in the community as a company, to be able to provide some services for frontline workers and things like that. So that's been good for us over the last 8 weeks.
Okay. Tell people just a little bit about some of the services that you do provide as city cleaners.
Yeah, so we're a full service dry cleaner, like you would think of. So anything from formal wear to casual golf shirts to a new big thing we're doing is a lot of wash, dry, and fold. So all the laundry you would do at home, we can do for you. We have probably close to 1,000 people that are on our home delivery service. So we're coming to people's house twice a week. So that's been good too. We've signed up tons of people on that side of our business that just don't want to venture out. We can come right to your house, no contact. Our drivers can set everything on the front porch or in the garage, and there's really no interaction with the customer. So that's been really good for our business there.
Good. What do you think is the biggest change that you've had to make to adapt to the conditions that we're living in right now?
Well, I think obviously there's a couple things. One is safety, first of all, for our team and our customers, making sure that everything is cleaned after every time it's touched customer goods. Everything has to be re-cleaned. Putting up all the guards, all of that sort of thing that you would think of as far as safety goes. But then also, we all build our businesses to run at a certain size and to be profitable at a certain size. And when your business is cut, in half, how do we quickly restructure as a company to stay profitable moving, in the next 6 months to a year? So that's kind of where we're at right now, is just kind of continuing to work through what that looks like for our team, what that looks like for our production facility and management and all those things. So.
Okay. As a small business owner, then what advice would you have for others, in small business to thrive in this whole new environment that we're in?
Probably the biggest one is don't be afraid to be. I think we got to kind of move quick on staying solvent as a company. Like, we can't just wait for things to happen. We can't wait for things to come back. We can't, like right now we're looking at what are other things that we can begin to do as a business. So, I mean, business wise, that is probably one of the biggest things, but then also, not missing this opportunity that we have, that is really a once in a lifetime opportunity to show our team that our hope is not in what we do, but our hope is in Christ. And just being able to share that with them. And, that's probably been the biggest thing to me. And a lot of times I have to have this talk with myself every day. But just for them to, when everybody's worried and concerned, for them to see the hope that we have an opportunity to share that hope.
Yeah.
So.
Very good. No, that's good. I think you used a key word there, Jeff, opportunity. When we see challenges like this, one of the things I've seen in the industry I work in is innovation as well. We're doing things differently and trying new things. I think we're more open-minded to say, okay, let's see if it works. Also, I think, again, a good point you brought up is that the hope's not in us. We're not the sovereign one here. Christ is the one who's sovereign and who's in control and knows what's going on. And this is where we're going to put our trust, so that, taking advantage of that opportunity to share that hope is also a great thing that you're doing there with your staff and customers. So thank you, Jeff. Anything else, Jeff, today you decide before we move on to the next interview?
No, I just appreciate the opportunity and encourage everyone, like I said, not to miss this opportunity.
Thank you, Jeff. Thanks for being with us this morning. Donna, are you with us?
So she is actually with us through her phone, which is awesome. And I don't know which phone number she is. So I'm going to unmute a couple of phone numbers and say not me. If you could just say something, Donna, to say hello. And that's not the right one yet.
Hello.
Oh, hey.
Hello.
Yes, we can hear you. All right. Let me tell you a little bit about Donna Skoda before we begin. Donna has worked in the community-based public health programs for 25 years. Her current responsibilities include the overall management of the health district, as well as managing the assessment and epidemiological components within the health district, data and information systems, and general strategic planning for the health district in the community. She has served as the lead of the Summit 2020, a quality of life project from its beginning, and continues to assist with local management through the Summit County Executive's Office. Previously, Donna was employed with the Cuyahoga County Board of Health for 15 years, implementing community-based programs in the areas of nutrition and many other areas in both the community and within the hospital systems. Donna is also a registered licensed dietitian with a master's degree in public health and nutrition from Case Western University. Donna, thank you for getting up this morning and being with us.
Oh, thank you. I appreciate it. I do apologize for all of the craziness with this IT. I mean, we're on Zoom meetings all day, and then this morning my Surface is dead. It won't pick up internet. My other computer doesn't have a camera. The voice died. I'm like, what could happen next? But I'm here.
But hey,
okay.
You're dealing with coronavirus. So what's a little technology problem, right?
Exactly.
So, Donna, start us off. I'm certain that right now you might be a little busy, but the spotlight has become on of course, the Summit County Public Health much greater than it ever has, at least in recent years. But prior to this, a lot of us probably don't know what the public health department does in Summit County. So let's start with, just give us a description of the role of the county's public health department.
Public health departments were organized, interesting enough, 100 years ago. In Summit County because of flu. It's interesting that at our 100-year anniversary, we're dealing with the same issue again, a pandemic. But in revised code, there are criteria that outline public health is required. The number one priority for public health is disease control. And we always look at it from an assessment assurance and a policy development strategy viewpoint, because what we need to have happen is make sure, and interestingly enough, Keith, your point is well taken. You don't know, a lot of folks don't know that every single day we have disease investigators out, we have individuals in the community working. Typically, it's not a new novel virus, but we are still working on all of the old diseases, measles, mumps. We look at HIV. We also are always looking for TB, Shigella, anything that is in the community. So it goes on behind the scenes, and a lot of folks don't know that that is happening in regards to disease control. We're also responsible and revised code for all the death and birth certificates, as well as clean water, maternal child health. We're responsible for clean air. We do all of the food inspections. Again, individuals don't realize we inspect every single restaurant in Akron, Summit County, at least 2 or 3 times a year. And that's a huge way to prevent foodborne illness and sickness in individuals. So our work primarily focuses mostly around the disease control aspect of public health.
Okay, great. Good. Yeah, that's quite an undertaking, and I think it all goes on behind the scenes without us knowing, and we thank you for those services. So tell us about the role you're playing now, especially in this pandemic.
Again, it's the disease control piece. We are looking at every single case and completing what is called contact tracing. And again, that goes on with every other disease that we have as well, whether it's TB or anything. Some diseases are far more contagious than others. Like measles, for instance, is about 19 times more contagious than the regular old flu, which is about a 1 if you want to use a 1. But if you look at coronavirus that we're looking at now, SARS-CoV-2, you're looking at a 2 times the flu rate of contagion. So people can get this pretty easily. So we are very much, once you are diagnosed or we have a confirmed, you're mandated by law to report that to the health department. And then we do we contact the person, we locate them, and do that contact tracing to make sure. We're also responsible for providing education to the communities, as well as trying desperately to provide more testing in Summit County as testing becomes available. This has been an unusual situation in that it's a novel virus. It is a global pandemic. So not only did it affect, the United States or Italy or China, it's affected almost every place in the country, the world, which then, because of that, affected supply chains. So we weren't able to get the swabs for the nasal test. We weren't able to get the reagents because factories were shut down. So it's been an interesting in that it's novel. There is no vaccine for it. And currently there is no known treatment. So it's been interesting in that our work has varied some, but really the biggest thing we're still trying to do is make sure as few people as possible get ill.
Okay, great. You talked about testing, so let's go there for a second. The testing options that are available to Summit County residents today, tell us about that, and then also what testing options do you see coming here in the Summit County in the near future?
Yeah, this is where we need some prayer, everyone. Please pray. We have been trying. This is the issue. Because testing was in such short supply, and particularly in Ohio, the reagents for running the test and or the test kits have not been available. So we finally have started to get a few test kits, but the state of Ohio, the Ohio Department of Health and the governor's office, because of the shortage, has listed priority areas that you're allowed to test. And those priority areas are now 1 to 5. One is any really sick hospitalized patient, first responder, or anyone who we need to keep on the front lines, a healthcare worker, a first responder, a police, fireman, ambulance, anyone on the front lines, as well as anyone who is hospitalized. The second tier is for individuals who work in long-term care, and they loosen that up a bit and let us do both symptomatic patients and healthcare workers, as well as asymptomatic. So we've been trying to test everyone who will test in a nursing home as long as we have the testing available. We also, then the third layer is you're starting to look at individuals at risk who have symptoms. And that's a key word. You have to have symptoms to just get a general test. And then they just added 2 categories. One is just general community testing, individuals at risk, and the other is for all the categories that you don't fit into. However, they have told us we still cannot do areas 4 and 5. So we have not been able to set up community testing yet. However, right now you could get a Rite Aid test. Rite Aid came to town as part of the federal government's task force, Corona Task Force, which allowed them to set up at Rite Aid. Now, they have a special waiver from Health and Human Services that allows them to test anyone 18 and older as long as you have symptoms. And they can do about 200 tests a day, and they are not at capacity yet. Cleveland Clinic is opening the Broadway site downtown, and they also have the Green site at the Wellness Center. They're opened because now you're allowed to test for pre-surgery because they opened up the surgery centers again. We are hoping to do some testing. We've been working with New Seasons out on Hawkins. We've also been working with, in North Hill, Asia Inc., and Chris Richardson's group Access Point, and talking to them about how, as soon as we are allowed, do we set up this community testing for everyone. So I'm hoping that within a week or two, and we're making all of the plans. The other thing I forgot to say, we are allowed to test if it's related to an outbreak. So if there's an outbreak in a jail, obviously a nursing home, and or if there is an outbreak in a like a congregate living setting, like maybe a group home or a place where individuals live, a halfway house. So it's complicated, Keith.
Yeah, no, it is. No, that's interesting. That, and I think it makes sense in terms of some of the those who are more vulnerable than others as they've set up those tiers. Maybe this answers part of this next question. But what parts of Summit County's population concerns you the most? Those that have been affected the most when it comes to the virus.
What worries me the most is the areas where obviously there are individuals that live who experience the social determinants of health, individuals who may not have health coverage, individuals who may work in lower paying jobs that don't have resources. Because what we're finding is a lot of individuals who we test are very hesitant to get tested because it means they're afraid they're going to get put off work. And they don't make a lot of money, so they work in 3 or 4 places just trying to survive. And so, I mean, the reform that we'll need to think about after this is how do you give people a living wage so that they can actually work in one place? I mean, we've run into workers that work in 3 or 4 long-term care homes because they get a day here, they get a day there. They don't work anywhere long. And if you have any sort of asymptomatic COVID-19, if you're carrying asymptomatic, which there is a percentage of the population that is asymptomatic and does not get sick, you don't even feel bad. That's why the testing is so critical, that we test everybody and make sure that in these settings, individuals get what they need. But I am most concerned about the 44320 and the zip code of 44310 '05, '06, and '07, because that's where we seem to have the most cases, as well as the number of individuals that are still working in some of these facilities that may not have the resources they need to be successful to manage. I mean, if you got to choose between going to work or eating, I mean, it's probably a pretty easy choice for most folks. So, I mean, we have to figure out a way to help these individuals be successful and stay home and get well so they can continue to work.
Thank you. Donna, you've dealt with public health outbreaks like this before, correct?
Oh yeah.
Okay.
I'm getting old, Keith. Okay.
Can you tell us a little bit about some of your past experience with dealing with this? These kinds of things?
I can kind of run through. It's like a walk down memory lane. Nothing has been like this, though. Let me say that.
Okay.
The first SARS, people always reference SARS-CoV-1, which, if you remember, it was like '03. It came in. It was in some countries. It was like in a few countries, and then it came to Canada. But that bug was very different. SARS-CoV-1 fizzled out after about 6 months, and there were about 8,100 people that got sick. That was about it.
Wow.
And I think in the United States, there was only like a confirmed 40 cases, and it went away. But it's a different animal. It's a different virus in that it replicated. When it got into your body, it was in the lower lung. So it replicated, and it was harder for you to spread it. This replicates in your upper respiratory, and it's easier to cough it out, sneeze it out, and spread it via air droplets. So this one has been much more difficult to control, as evidenced by the quick spread across the world. Then it was about 2006, we were dealing with bird flu, if you remember that. The bird flu was here, and that again was a different sort of flu bug, and a vaccine was developed. And when that was developed, again, the impact was nothing like this. And now that's just part of the regular old flu vaccine. We take A, B. But then along came, in 2009, it was about 9/10, we had H1N1. And if you remember that swine flu, that was very, very different because, again, the recommendations were that we had to immunize pregnant women. The vaccine, again, was in shortage. We had long lines trying to give vaccine to priority groups. We were all over the county trying to vaccinate. But again, that was a different bug, again, than this one, because this one is, and I just want to say just a minute, just so you understand, this virus, SARS-CoV-2, acts like nothing we have seen before. There's some good evidence now that says maybe it'll die down in the summer. But, we thought that you're most contagious that maybe 2 to 3 to 5 days before you get symptoms. So you're walking around feeling just fine, don't know you have anything. Then all of a sudden you might start sneezing or have a headache or not feel right. And then you just don't feel good for a day or two, and then you're fine again. That's what we talk to. We talk to a lot of people who say that was their experience, who then test positive for COVID. I've talked to a lot of people who have just said, I was never sick a day, but they have COVID. And so we're dealing with an asymptomatic carrier. That's why we still have these recommendations that people wear masks, that people, cover their cough, sneeze, stay 6 feet away from folks. After Easter, we saw a bump in the numbers. Mother's Day, we're seeing a bump in the numbers. And I think, and then I have to say this too, when all of this started in March, where we shut everything down, I have to tell you, the regular old flu bug died. It went away. We haven't had a case of flu in Summit County because nobody's been around anybody. That's how disease spreads. getting close to people. You know, you have to stay that 6 feet apart. And, you know, we've done a lot of work with talking to folks about there's some activities that we know spread it more. Talking really loud, singing because you expel a lot more air. It's a way that you can actually spread the disease more. And then the last thing I just want to mention, it was in 2014, we had Ebola that spiked up in Liberia, and there was a few other areas, and then we had some in the United States via travelers. Right. But that, again, quickly died out. Ebola flares up all the time and then goes away in these small pockets, but we watch it closely because with the way we live now, you know, everybody travels everywhere. In fact, that first SARS-CoV-1 that we had in 2003, every single one of those cases was tied to travel. And when this thing started out, it was tied to travel. But now there's widespread community spread. So the travel factor no longer matters because it's everywhere.
Thank you. I want to mention to everybody on today's call, we've got the chat at the bottom, and if there's questions that you would like to ask any of our participants today, and especially Donna, go ahead and enter those into the chat, and we'll be able to post, get those to maybe we can get to those before we end today. What do you think you've learned the most through this particular pandemic and the quarantining that we've done so far, Donna? What have you seen as a result?
I think what we've learned the most is that all of the planning we did was planning. You know, you write plans and they've all been very helpful. But when the rubber hits the road, you need mitigation. You know, you need places to have folks recover safely. You need to make sure you have adequate food for individuals. You know, we have never in our lifetime seen where our economy has just shut down, leaving individuals without work, without income. You know, many people live in service jobs where you know, like if you're a bartender or a waitress, you live off of what you get every day. And everything just shut down. And the systems weren't really ready for it. And so it's created this secondary trauma of everyone being not only afraid of being sick, but then not financially not being able to survive as well. What I'm really worried about is when these events happen in communities, typically you'll see, you know, we'll see after this is over, we'll see spikes in cancer rates. We'll see spikes because people won't go get tested now, or they'll ignore symptoms, individuals, or they might not have access to health care. So, I mean, really the real cost, another cost to this is the emotional, the economic, and just the despair that comes with really hard times. And the one thing I've learned about humans, and this is in quarantining, we have the power to isolate and quarantine. I mean, we can force you to stay in your house and put a guard outside your door and make you stay in. But I have to tell you, Keith, not one person ever gives us a hard time. Everybody does their part. And it's really encouraging to see that, because people realize the seriousness. And they do try to help as much as they humanly can. And if they have trouble getting groceries or have trouble staying home, they call us and tell us, and then we arrange for them to get food.
Oh, great.
But it's been good. I mean, it's just been a real eye-opener at how the systems weren't ready for this kind of mass destruction. But I don't know if anybody could have thought of it ever being like this.
Right. Donna, thank you. I want you to hang on for us if you will, but I want to thank you. I think we've learned a lot more in this short amount in this conversation just this morning. My eyes have been opened in learning more about how this particular disease works and how it's different from others. And so thank you for validating a lot of the things that we hear, because I think there's still those that have their doubts at times. And so again, we also pray for you and your leadership in this organization, and And thank you for your service and all of your staff for their services.
Thank you as well. And I appreciate the prayers. Keep them coming.
All right. I'm going to, I want to go next to our next guest is Reverend David Nelson. He's been serving as senior pastor of New Hope Baptist Church since 2007, and it's located near I-77 on South Hawkins Avenue. David, you with us?
Yes.
Good morning. Good morning.
Good morning, everyone. Good morning. Glad to be with you.
All right. You've had you're pastoring a church that's been around for some time, and so tell us about, from a pastor's perspective, how this has affected you personally as senior pastor of a church, and what has been the biggest impact that you've seen on New Hope.
So this has been a transition for myself and our church overall. We've had to shut our church down as of May 22nd, and having discussion with our leaders about doing that, and thinking that the shutdown was going to be temporary, let's say within 3 to 4 weeks, but also looking at what is going on, what was going on around the country, what was going on in our county, and certainly in our city, and how the virus has spread. And with no real significant end in sight in terms of how it was going to affect our community and our congregation. And so it has been an adjustment, for us. And every week it changes for the most part, and how we have to communicate information out to the congregation, especially as the nation and even the state has lightened the safety precautions and requirements for gathering. And so, and it's been somewhat of a mixed message because, in other states, how churches are being addressed. And then within our state, churches are not really being directly addressed. So we sort of have to come up with a message sort of somewhat on the fly, because there is not a reference point or any best practices that's out there. And so having to make a decision about what's the best for our congregation, what's the best for our community, and really, putting people first, and making sure they understand that and they know that.
What are the changes that you've made in how you operate the church and how you serve the congregation?
So our biggest change has been streaming. Prior to us having to shut down our church, and we share the message that although the facility is closed, the church is always open, and that the church is not the building, the church certainly is the people. But it is vital historically that we've always had a place to gather.
Were you streaming before the coronavirus? Were you doing any of that online?
No, we were not. We were not
Okay.
streaming before then. We've had multiple conversations about it, and so this has thrusted us into having to stream, and so the positive piece of that is I pastor somewhat of an older congregation, and so we have more people on Facebook, more Zoom meetings, more conference calls, and utilizing technology in various ways. And it is exposing those within the congregation who may not have ever participated in these particular platforms. And so, and that has been good, as we found multiple ways to continue to connect with one another. And so the streaming has been working pretty well, which I'm, very certainly glad about, in terms of people have been viewing us on a week-to-week basis. Just instituted Bible study a few weeks ago. And so that has been great. And then, with that, having conversations with other pastors in the city and also around the country, and seeing what they're doing and what adjustments they've made. So we have a small gathering of individuals that come to the church. And so we try to limit the number to 10 so that we can put out there on a social media platform an experience of church. So we still have music. We have no choir. We have a praise team, and we have a few musicians, and then we have abbreviated our service as well. So our service now is about under an hour, and still trying to get somewhat of a church experience. And so even when people are coming into the church, and those 10, a few people that come, we're doing, checks at the door. Everyone has to do a temperature check. Everyone has to sign a form to let them know that they have not been in contact with anyone with COVID-19. So our health professionals have been helping with putting in those precautions. We make sure masks is being worn. We make sure that areas in which people are at within the sanctuary are being disinfected and sanitized and things of that nature. So, and make sure that even the praise team is standing 6 feet apart. And so there are social distancing in that regard as well too.
I'm guessing your congregations, like a lot of congregations, there was probably a lot of hugging that used to go on, right? A lot of greeting and shaking of hands, and so we're going to have to adapt to that as well until there's a cure for this. So, David, for any other pastors that are in our audience, from your learning so far, what advice would you give them into adapting to this new environment? What hope can you give them?
Well, ultimately, of course, our hope is in Christ. God has not given us the spirit of fear, but of love, power, and a sound mind. And so we have to continue to be diligent, continue to be cautious, continue to advocate and work with our health systems, as well as our county health, in terms of advocating for testing in our communities, because our communities are greatly affected by social determinants of health. And so we have to continue to stay on the front lines and continue to also pray for those on the front lines and find out ways that we can support, those doctors and nurses that continue to be engaged in this COVID-19 environment, and make sure that we're putting people first. Of course, every church, makes their decisions differently, but we want to make sure that we are able to contribute to certainly flatten the curve. And even though we may not know when we may return, with no clear return date, even for those churches that may be returning back within the next few months, and just making sure we're putting some best practices in place, and speaking with health professionals so that we can certainly make sure that safety is first. Around the country, especially within the African American community, within Black churches, many pastors have died, some particular to certain denominations, and oftentimes when church is gathering, because of those who are asymptomatic, and even those who may have had some level of symptoms, it is spreading, and having to go through that, and the church having to shut down again, and the church having to go through a process of being disinfected and things of that nature, deep cleaning, is disheartening. And so we want to continue to pray with one another, pray for one another, and make sure that we all have a message that we in this together.
Brother Nelson, thank you for being with us this morning.
Thank you.
Our final perspective is from someone from a younger generation, and it's Dana Elizabeth McKinney. Dana is a recent graduate of Kent State University with a degree in photography. She is owner of Dana Elizabeth Photography, but also she has an aspiration for fashion photography someday. You can find her on Facebook under Dana Elizabeth Photography. Keep that in mind, write that down. And from there, you can go find her website. And if you find her website, you will see some absolutely beautiful photographs. She's very talented.
Thanks.
So. You're welcome, Dana. So thank you for being with us this morning.
Yeah, thanks for having me.
So you got to experience your spring senior semester through the coronavirus. Tell us,
Oh, yeah.
how did you were living on campus, correct?
No, I live at home actually with my
Okay.
mom, who is
Okay.
downstairs in our kitchen right now.
All right. So how did this affect your senior spring semester?
It was honestly kind of a bummer. Everything got canceled, so all the traditional graduation traditions. So obviously, like walking across the stage and getting your diploma and
Sure.
everything, and being able to graduate with my friends. So that was kind of a bummer. And then also for my major, we have a senior art gallery, so that was canceled, which was also a bummer. But it wasn't all negative. I definitely still graduated, and I was surrounded by my family, and my aunt and uncle did one of those like drive-by honk things, and and
That's
made
good.
a sign and everything. And of course, I got emotional. But yeah, so I felt very, very loved and supported on graduation day, and it was kind of nice because it was snowing, so I got to sit inside and just watch it on the TV instead of sitting outside in the snow. But yeah, it's weird. I've taken online classes before, but it's weird
Yeah.
doing everything from your home in your pajamas and having like zero structure to your schedule or your classes. And then a lot of my classes, you end up kind of teaching yourself because there's only so much that they can give you online. So then you kind of have to fill in the rest by yourself. So it was definitely a little bit of a confusing time, but I'm glad I got through it. And
Sure.
yeah, it was good.
Yeah. I certainly recall my college days, and it's such a sense of community. You're all you're all going through the same thing, living
Yeah.
together, and even the classes, like you say, are all community, and you get to know people, and you learn from their body language, and now it's all
Mhm.
on the screen. So that certainly was quite an adjustment.
Yeah.
What's the greatest obstacle you think that you faced, or some of your friends have faced throughout this, and how did you overcome it?
Honestly, this might be a weird answer, but finding the motivation to graduate.
Okay.
Just it's so hard when you're again at home, not much structure to your class or your schedule, and you have an 18-page art history paper due. And it's like, well, why do I want to write an 18-page paper? So it's was very hard finding motivation to not sleep in all day and get up and do my schoolwork and kind of figure it out on my own. And then for my major classes, we have weekly critiques. So definitely getting used to the technology shift of doing everything over like Zoom, Google Hangouts. It was all confusing and kind of difficult at times because everybody cuts in and out with service, and so can't always hear the feedback. So just kind of, and then just getting frustrated with that. So just kind of the motivation to stay with it and finish. But in terms of overcoming it, I definitely turned to prayer a few times, asking God, just, please help me stick in there, give me the strength to finish, and as well as my classmates. And because there was a couple of times where I got texts from my friends and they were like, I can't do it. I can't deal with this. And, a couple of my friends struggled with depression and things like that during this. So just praying for them and everybody during this time and just getting through it. But yeah, so thankfully, God gave me the strength to get through it, and here we are.
Well, Dan, I think what you just said, and what as you described it, I think we could parallel that to a lot of different people, a lot of different generations currently. I think a
Mhm.
lot of people are struggling for, everybody's saying, what day is it? Well,
Yeah,
that's a sign too. And even Donna Skoda mentioned, there's depression that's going on. And so
Mhm.
there's a lot that affects the entire community. The cliches, we're all in this together, but it's
it's
absolutely
true.
true. And
Yeah.
it's affected everybody in some way, and why we're doing, this different perspectives today. So
Mhm.
um, tell us about how has it affected your photography business, as well as your career plans, and some of your friends' career plans.
Yeah, well, when you graduate, the first thing any family member or anyone asks as your topic of graduation is, so now you have a college degree, what are you doing? And my answer has just been a soft chuckle because there's a pandemic, so not much. But I still, I've been applying through LinkedIn, Handshake, Indeed, all those kind of websites, and keeping up with contacts and following up and whatnot. So I I've been trying to do as much as I can, because hopefully I'm praying that I can start out in like marketing or photo editing or assisting or something like that, probably to start out. But like you said, ultimately I want to do fashion photography, but a lot of those hubs aren't hiring at the moment just because they're not the safest in terms of coronavirus. So that's what's happening with a lot of my friends too, even with agencies in Cleveland and stuff. My friend Stephanie wants to freelance for the couple of photo studios that are in Cleveland, but they're not even allowing freelancers at the moment to do much. So everybody, it's just kind of a waiting game. So yeah, I'm still available. If anybody has weddings, senior pictures, anything that you need, I'm still doing all of that. Obviously at a safe distance and wearing a mask and whatnot. So thankfully I've had a few senior picture sessions, so that's still going, and signed a couple of weddings. So in terms of like my business, I'm still signing a few things, but obviously everything's kind of postponed. Like the 2 weddings that I have are postponed to October. So, but thankfully they're still happening. So in terms of my business, it's still going. It's obviously a little bit slower than usual, but in terms of like big career plans, it's kind of a waiting game right now. So
okay.
Yeah.
Okay, we'll be praying for you and all the graduates. And
Thank you.
yes,
Yeah.
I understand.
Mhm.
I want to just open it up. Ben, do we have any questions in chat for any of our guests today?
We do. And thank you everyone that has jumped on here today. We appreciate you with it. So Jeffrey Dennis was actually asking our pastor earlier, Pastor Nelson. He's like, how can we help with your purpose, was his question. And I'd love just to have you answer that if you could, Pastor Nelson. Let's make sure you're unmuted.
Yeah, now there we go.
There we go.
Yeah, there we go. I think, really coming together and having, great conversations like this. I think also even from a mental health perspective, it's important to have conversations. One of the things that, our church has been addressing as well within our congregation and even within our community is how this coronavirus has exacerbated, individuals' mental health in terms of anxiety, depression, and trying to walk with them, and also recommend seeing a therapist, which is often a misnomer within our community. And so I think it's important to check up on people, to not just pray with them, but to walk them through and connect them with certain mental health professionals so that they can know that it's okay just to be okay. Every day is not going to be great. And the fatigue of having to stay in and just the fear of being able to be around people. And so just walking people through that process. I think it's important to have those conversations and know what resources is certainly out there, even with the restrictions and the safety precautions that we have as well.
It's awesome. Thank you, Pastor Nelson. And for anybody that is, of course, has that stigma around counseling, guys, I've been to counseling a lot, and it's very, very helpful. So look for that. Maybe one more question, or maybe 2 questions, depending on our time. This is actually to Donna Skoda. You should be unmuted. Are you there, Donna?
Yes, I am.
Skoda. Am I saying it correctly?
Yes, you are.
Yes. All right. Yolanda asks, are the Rite Aid testing sites only in Summit County?
No, there's one. They have one site in Summit County, but they are also in a few other counties and states. But in other counties like Cincinnati, down by Hamilton, Franklin, they partner with other like Walmart, Kroger. There's other entities doing it. Rite Aid is the only one, and in Summit County at the green location is where they're doing it. But they're in a lot of different states and other counties in Ohio.
Awesome. Also, then with that, Just to make sure, I know we put these out here in a number of different places, but what were those zip codes you listed them off really fast, and the coffee's still
I'm sorry.
kicking in. So what was the zip codes?
Okay, it's 44320, 44310, 44305, 06, and 07.
Awesome. All right, Jeffrey Dennis also, or wait, that was our question earlier. I apologize for that. This is actually from Herman. He says, when do you think the state of Ohio will approve community testing?
I am hopeful that we're hoping that by June 11th to the 15th, we get some notice. That's why we're preparing now to be able to do this community testing. In the case of other entities, the governor on his last call had mentioned that federally qualified health centers will lead some of that community testing, which is perfect. I mean, we're fine with that. We're glad to partner and help any way we can. I just don't know if they're going to have adequate testing or not available. That's kind of what we're waiting to see. And then once you have the testing, you have to have the capacity for the lab. So we are hoping at the latest by the middle of June.
Man, I love what Dana said earlier, that it is a waiting game. I feel like we're all living in the waiting game. Maybe I believe this is the last question. If you guys have any more questions on live stream all across the board, Zoom, all the places that we're streaming from, please put those in here, and we'll make sure to answer them and connect you the best we can. But I love what from Facebook asks, what are the requirements to be a community testing site like Access Point?
The requirements, basically, it's not necessarily a requirement. What we do is we have probably 35 to 40 sites all over the county identified. It's more a matter of being able to get in and out of a site and to have ease. Like, for instance, we have marked every single high school, every single e-check station that are probably no longer functioning, most of them. But we've been able to identify spots where we know we could have drive-through. And so those are already identified all over the county. And then we work with our preparedness folks, and we set up those testing sites. So it can be in any number of places if you're going to do community testing. Rite Aid selected the green site. I don't even think they knew where they were picking. I just think they picked a site based on traffic control. Because when we first talked to them, like a day before they started, they were thinking they were in downtown Akron, and they weren't. So I don't even know if they really knew where they were at. They just picked it based on the traffic control. That's a lot of it. It's being able to get in and out of a site. And then you have to have the testing, obviously. You have to have the test kits and the ability to have the person swabbed by a medical professional. And then you have to be able to send those to a lab.
Wow. Well, guys, it is just past 8 o'clock, just to let you know. We will continue our conversation, but if you jump off and need to jump to something, feel free to. We're always here with Love Akron. We love you. We do have one more question for Don, and then I'm going to go over to Coach Kemp Boyd. What is most important for folks to understand about the asthmatic individuals?
Well, any under any underlying condition, any pre-existing condition does increase your risk for any disease, but particularly COVID in the lungs, because COVID for some individuals does seem to settle in the lungs, and that's where you get the pneumonia from. So individuals who have that pre-existing condition with asthma, it may be it will certainly be exacerbated by any sort of cold, cough. You know, it's a bad allergy season. As beautiful as it is out right now, there's still lots of pollen circulating. So for individuals who have asthma, they should be particularly careful. and stay away from individuals, wear a mask, 6 feet apart, those sorts of things. Wash your hands, wipe off your surfaces, all of those things we can do. And for goodness sake, use your medicine, your asthma meds for control, to make sure that, there's usually a daily med, and then there might be a med if you have a quick, like a quick response inhaler in case you have an asthma attack. But you really want to make sure you take your meds, your medications, if you are an asthmatic during this time.
Awesome. Well, from all of us at Love Akron and across Love Akron, thank you so much for being on with us, Donna. If you do have any more questions that people want to ask you, is there somewhere they can email, somewhere they can go?
Oh, yeah, for sure. You can call me. You can call me direct. I can give you my cell phone. It's 330-313-4943. Or you can email me at D as in dog, Skoda, Skoda, at schd.org. And that stands for Summit County Health Department.
Awesome. Well, thank you again for spending some time with us, Donna. So I want to bring on the coach, Kemp Boyd, coach of Akron. How are you doing, brother? And hasn't this been great?
Hey, good morning, everyone. Yeah, this has been a very, very informative time. So I want to thank everyone who was on as our guest. I want to thank Jeff Sitz, Donna Skoda, Reverend David Nelson, and also Dana McKinney. Thank you guys so much for your time and sharing a little bit of your story, but also your success during COVID-19. Very appreciative of that. And just want to let everybody know that we always meet here at Love Akron Connect the last Wednesday of every month. So our next Connect will be June 24th right here. We'll be doing this virtually again. So, and we're excited about it. We love the way that we do what we do during COVID-19 and possibly beyond. Also want to give a shout out to Gloria Terry. Gloria, I know you're still on. And I did what you asked me to do via the message. I couldn't send it because I got something waiting in my inbox that I had to cut and paste. So, but I want to let you know that I did do that and reached out to Pastor Nelson. And want to also encourage everybody, please be watching out in your own inbox and Facebook for the announcement of our next Love Akron Connect and who's going to be our guest speakers on that as well. And please invite someone to be your guest. Bring them along, invite them to attend, tell a friend, and bring somebody with you, okay? And also want to just make you guys aware that we are having our Love Akron Annual Awards Breakfast September the 29th, and you're going to have an opportunity to nominate someone that you know that is well deserving of the Brenda Unruh Servant Leader Award or the Pastor Ron Fowler and Pastor Newt Larson Allies Award. So that is a link right now that I just sent out in the inbox. If you know anybody that is deserving, please, please, please nominate those individuals. We have extended our nomination deadline to June the 22nd. So if you can get that to us, or you can go to our website and visit it as well. Just who are deserving individuals that need to be nominated for these two awards would be a great opportunity for you to do that and to be a part of what's going on in Love Akron. And so just as we leave, if I could just share just a second of some of my own things that I've learned through COVID-19. And probably I told this to our team, I think when this first happened, there's so much opportunities in this. And the one thing that I've talked to my own family about is, man, how can we really honor the hiatus? Because that's what it's kind of been for all of us. It's been a hiatus or a direct disruption to the normal way or the continuity of work. And so I want to make sure that once this is lifted, that I come out of this better spiritually, mentally, physically, and emotionally than I was when when I went in. So I just want to make sure that when I come out, man, that the next stage of this process, I'm ready to run the way he's designed me to do so. So just wanted to encourage everybody for that. Thank you for all of our guests encouraging us this morning with really great testimony and information. And so we're going to sign off. And we always say, man, if you don't do anything else today, we want you to love Akron.
That's awesome. And actually, I would love, I'm just going to unmute everybody real quick. This is going to be loud for just a minute. So all you got to do is say is love Akron here at the end. So I'll unmute everybody. Oh, I hit mute. Wrong way. Who's ever been in this with Zoom meetings where you hit a wrong button? All right. So if you don't do anything else today, guys, make sure that you
love Akron.
We love you guys. Make sure to check out those links, and we will catch you guys later. Thanks for being with us.
Thanks, everyone.
Thank you.
Thank you.